Hi, everybody. I'm Jamie Burse, and I'm joined with Mike Crosby. We're from Zero to the End of Prostate Cancer. And Mike is a retired naval commander and Top Gun fighter pilot, and he's also a veteran fighting prostate cancer. Thanks for joining me, Mike. How are you?
Good, Jamie. Thanks. Really appreciate the opportunity, and it's everything that Zero does for prostate cancer patients in general, but also specifically with our new Veterans Initiative. And I know we're here today to talk about the Mission Act and what it provides for veterans in their fight against prostate cancer.
That's right. It's a key program. When you look at, not many people know this, but there's 500,000, let that sink in, that number sink in for a minute, 500,000 veterans with prostate cancer in the VA system right now. And so what can we do to help them? And one of those key programs is the Mission Act. So tell me, Mike, what is the Mission Act? What are we talking about?
So Mission Act is a very broad acquisition program. As Congress names a lot of different acts, they named this new administration named this act the Mission Act, and it was to help with Veterans Administration specifically. But then inside that Mission Act, there was a component that is set aside to help the community care network. It was to sunset what used to be called the Choice Program. And this act was passed in 2018, in June of 18. It came into being. I mean, it was appropriated, and then by the time it takes about a year for it to become enacted. And so June of 2019, the funds were made available under the Mission Act for the community care network. And I know these are a lot of names. I'll put out a disclaimer now. Go to our website at zerocancer.org/veterans, and you'll have access to all of these different names and these references. But what's happened is Congress appropriated $100 billion, and yes, that's it's a billion with a B on it, over a 6-year period of time to care for or provide for resources to care for veterans outside of the VA. And it's a program that is a little bit underutilized right now because not very many people know about it. And that's why we're here, is to walk people through, both providers and also patients.
And why should veterans care? What are the main benefits for a veteran of the Mission Act, of this program?
Well, the whole initiative started back in 2014 and 15 when at Phoenix VA system had all of those problems in the press with long delays or not even being answered, scheduling issues and that sort of thing, where veterans are dying waiting for treatment. So at the time, President Obama passed through very quickly the Choice Program to allocate these funds. And what's happened is Congress has seen the need and seen the application of these funds. And what it really is for is to allow veterans that need care and that the VA can't meet the timeline, or they don't have the specific care capabilities or the modalities for treatment that are inside, that they're just not existent inside the VA. It's to allow those veterans to get the best possible care out in the community setting. Essentially, just walk across the street, get your treatment. You have to do it with a referral, and we'll talk about those details in a minute, but you walk across the street after you've gotten a referral, and that treatment is paid for, and then you come back to the VA for your continuing treatment. But it's really it's a great program, and I know about it because I use it, and I'm in the middle of treatment in that whole process. And some of my treatment is outside and some is inside. And that's why we're talking about this, is I'm kind of learning this. I've learned it. I would call myself actually probably one of the expert users of this program. So anyway, that's really what it's for, is that money to treat patients outside the VA.
Well, we've all got your back on your ongoing treatment, Mike, as well as all of the veterans who are going through their prostate cancer journey as well. As we all know, that when it comes to prostate cancer, there isn't a cookie cutter treatment for everybody. So you need to have really that whole spectrum of treatments at your disposal in order to be able to fight prostate cancer. So that's key for veterans, especially because they're one of the most highest risk groups of getting the disease. Now, how can a veteran enroll in the program?
As of this year, this last fiscal year, all of veterans, if you're receiving care and you're eligible for care at the VA, you are automatically enrolled. It used to be that you had to sign up and get a temporary card. That has gone away. And all of if you're receiving care at the VA, there's over 9 million people receiving care inside the VA's healthcare system now. They're all enrolled. It's automatic. You use the same card, the same number, your same ID card, just as you would use an insurance card or a Medicare card on the outside. And that number, your veteran's ID card, is going to have a number on it, and that's what you use when you go and report to your outside care. So there's nothing that a veteran has to do. What a veteran has to do now is just ask about it. He needs to ask that's what they just have to ask, and then wait for a referral to come to them. And if it's an issue, especially around prostate cancer, if you've been diagnosed with prostate cancer, you're going to be seeing the oncologist and the urologist and the radiation oncologist inside your local VA. It's also good for primary care and the nurses to know about it as well, to actually be able to tell a veteran, we may not have these options for you inside the VA, but you need to ask to be referred out. Or if you've talked to Zero or you've found a local provider, we can help sign up that local provider, and we'll talk about that in a session as well. But we can help you progress your way through this, or make sure that you're asking the right questions to get the best state-of-the-art care.
Now, as we referenced just a minute ago, that veterans are at increased risk for prostate cancer. In fact, prostate cancer is the most commonly diagnosed cancer among our nation's veterans. How can the Mission Act help with prostate cancer care and treatment for our nation's veterans, Mike?
Well, thanks, Jamie. It's recently been recorded or put out that there's a shortage of oncologists inside the VA. And that really leads to one of the prime reasons why the Mission Act was actually enacted by Congress. We know that there's a shortage of care. There's also a shortage of facilities. There's less than 50 radiation centers or sites inside the VA, so a majority of any kind of radiation treatments are going to be outsourced. Right now, there's two ways to get referrals. You can either use the standard VA referral, which they've used forever, so every hospital has its own referral dollars, but they can also use this Mission Act funds, right? So they can request to go out to a radiation center or a cancer treatment center that has that modality. But that cancer treatment center has to be signed up. And again, we'll go through those steps as well, but it's essentially up to the caregivers or the physicians and the patient to have that discussion and to make that request for a referral into the program. With right now, with over 14,000 new cases every year of prostate cancer, this issue is not going to go away.
What do veterans need to know about receiving care from healthcare providers or their doctors through the Mission Act? A
couple of things. One is, if you have a preferred provider that you know in the community that you like, or that you've seen or you've heard about, we encourage the veterans to ask those people, those centers, to sign up for the Mission Act. And if they have someone willing to do that, both Optum Corporation and also the Tri-West, who are divided sort of East Coast and West Coast, will engage with that provider and qualify them, sign them up and make sure that they're a qualified provider. We've seen that sign-up period take from 1 day to maybe 30 days. I think the VA advertises that it's no longer than 30 days to get someone qualified and into the program. But what they do is they make sure that the provider is qualified, that they don't have any Medicare black marks, and that they do take Medicare rates, because that's how they get reimbursed, is through a Medicare rate structure. And they sign a contract, not necessarily with the VA, but actually with Optum and with Tri-West. And then the scheduling and coordination comes from those organizations that have been contracted and incentivized by the U.S. government to make sure that veterans meet their schedules, they get there on time, and that they get the treatments that they need. Now, one thing I always tell veterans and remind them is that when they get their treatment, they need to return to the VA with their records. It's still not seamless, okay? It's as much as we try, we know there's a lot of IT upgrades going on, but it's incumbent upon the veteran to advocate for his own care, but to also look after his own care and become part of the care team. And part of that responsibility is making sure you get copies of images and records and return those things back to the VA, because that's where your follow-up care is going to go.
Definitely. And you had mentioned electronic records, able to bring your records back into the VA. Now, the Veterans Health Administration is such a vast system. How can veterans learn more about navigating the system so it can be a bit more seamless and really get the seamless care that they need?
Well, one is go to our website, look at our website, the veterans page on our websites. I think the other side is that, go to va.gov. It's the website at the VA is being updated regularly now. I think we're into a good rotation of getting those guys updated. You can go to your VA and you can actually sit down and ask them about where are they in their update cycles and what capabilities do they have. I'm finding myself with my own care, a lot of the doctors that I see are actually able to exchange information now digitally, like record files and image files and MRI files, those sorts of things. They're able to pass those back and forth. There's actually now a system that just came online within this treatment cycle for me that allows me to digitally link and to register my outside physician with my inside the VA physicians.
As a veteran on the front lines of the execution of the Mission Act on behalf of cancer patients, and as a prostate cancer survivor yourself, who's benefited from this program, what are some key takeaways for our veterans that they should go and consider and talk about to their doctor?
Yeah, one is, the first and foremost is early screening. If you're a veteran, we have studies that aren't conclusive yet, but they're ongoing. But we have studies that are showing that veterans are at a higher risk of developing the disease at an earlier age, right? So whether we don't know why, we suspect it's exposure to things like radiation sources or chemicals or jet blast, jet fumes on the flight decks or on the flight lines. Even studies are showing maybe high rates of adrenaline from combat adrenaline type of sources are breaking down DNAs or affecting the DNA. We just don't know.
Yeah, I've seen studies on depleted uranium too. Yeah.
Depleted uranium, I mean, guys sitting in A-10s or in the M1A1 tanks or handling or loading those weapons on board and that sort of thing. You're just in close proximity to various radiation sources. Pilots flying airplanes, also flying at 30,000 feet for 3,000 hours, right? Mm-hmm. Not too many people do that sitting inside of a bubble, and except for us military aviators. I know there's a bill just passed to try to encourage the Air Force and the Navy to look at military aviators and this high rate of incidents that we're starting to see. So we don't know if it's UV radiation or if it's radar radiation or whatever, but we do know we're seeing a higher rate of incidents, both probably or numbers wise and also maybe even a reduction in age wise. So I try to tell guys there's nothing wrong with going to get a screen. I mean, we know that the Preventive Services Task Force guidelines have changed. Those have not been promulgated throughout the whole VA. I mean, even today, that's not going on. It's not a standard implementation of policy, right? And that's something that we as advocates are pushing for very hard, is that, and as you well know, Dr. Dunn, Congressman Neil Dunn from Florida, has introduced a bill to implement a clinical pathway for prostate cancer inside the VA. A lot of the physicians would really like to see that because it would help to standardize how all of the VAs and how this whole population is treated. As a man over the age of 40, you better know what your health is about, and you need to go get screened. Go have a discussion with your doctor, make him address these things with you. Ask him the hard questions about when do I need to get screened? Why do I need to be screened? And understand what a prostate is. Don't wait till someone tells you you've got cancer to start to figure out that this can affect anybody.
What are some resources that are available that veterans can get their hands on if they have additional questions about the Mission Act or about their
care? Absolutely. We together, Zero, is putting out two flyers. One flyer is going to be intended for the veteran himself to introduce him as to which category he's in, or which part of the country that they're in. It's all based on your location. The contracts that were let to Optum and to Tri-West are divided up in two sides of the country. The East Coast, think of from essentially the Mississippi River east, with a little bit of the North or the Midwest, is all under Optum Serve, which is a division of United Healthcare. So they won essentially a $50 billion contract to administer these funds and to manage the Mission Act Community Care Network program. On the west side of the country, it's Tri-West, who have been in this program since the initial choice program days, and they handle the west side of the country. Their same contract, same $50 billion, and their charge with scheduling and also with administration of the program for the West Coast. As a veteran, you need to know those guys. You need to know their numbers. Put it in your phone book, put it in your phone as a contact point. You can dial up a phone number and they'll answer, they'll get you through the system. If you think you have a contact or an appointment, they're the ones that have the schedule in front of them. And that really is very seamless. Once you make a determination for a referral, you get an email alert and you get a phone call, and then you schedule, you confirm your appointment, and you just go to your appointment. No money's required, no IDs, no paperwork. You show up with your ID card and you do your appointment. You make sure you get the records back to the VA after your appointments, and you determine what your treatments are. But really, if you want these resources, and here it is, zerocancer.org/veterans. We're actually looking for vets, one in every state, that can help us deliver nice hard copies of these things to every VA. And we'd like to get one veteran champion in every state to work with the various VAs and to hand out that literature. So this is my call of action to try to start that recruitment process and identify yourself. Sign up, give us a call, send an email, and we will be in touch with you and to solicit your support in every state.
That's right. Yeah, come in and join us. If you're a veteran, we want to hear from you in order to be able to, as we said, build this army in order to be able to end prostate cancer. And we can't do that without caring for our nation's veterans. As I said before, Mike, well, first of all, thank you. But as I said before, we've got your back on your prostate cancer fight as we do. We've got the back of every veteran, all 500,000 of them in the VA system who are fighting their prostate cancer battle now, and anything that we can do to help them beat prostate cancer, we're there at any time. So thank you for joining me today and getting some of these questions answered for our veterans.